Good morning, everyone. This is Miss Tara Dennison. I am starting out our fundamentals with Chapter 1, which is the Vista of Nursing. I am hoping beyond hope that y'all have already read this. But let's talk about a Vista, okay? This is an open, unblocked view. So I want you to look at where you are, where you've been, and I want you to look at where you're going. You have finally made it. Each one of you have a story. Each one of you have a past. You are all headed toward the same goal in the future. You might each take different paths to get there. You may each have a different love in a particular field and move toward that path. The good thing about nursing is that it has such a variety of specialties that you may never have to stick to the same thing if you don't like the path you choose. When I went to nursing school in 2001, I never would have dreamed that I would be teaching nursing students at some point, but here I am. I love it. I graduated nursing school when I was 19. And I've been a cardiac nurse, a hospice nurse, a home health nurse, a long-term care nurse, supervisor, and I have worked in outpatient procedures. Each experience I've taken with me as I've went through my nursing career to try to make myself the best nurse possible. And that is my goal for you all. I want each one of you to know that the next year of your lives is going to come with a lot of tears, heartache, hard work, dedication, and teamwork. And without all those things, you will not survive. I want you all to do everything in your power to enhance the lives of not only the patients that you're going to come in contact with, but also your classmates who are going to be your life vest over the next year. Lean on each other because you all have the same goal. Some of them, your classmates, your instructors, will get on your nerves. Some are going to make you angry. Some are probably going to make you cry at some point. And some of them are literally going to stay in your lives forever. So respect each other, no matter your differences. If you do not respect each other, you will not survive this next year. Be kind. Nobody likes a butthole. Be considerate if you want others to be considerate to you. We all have different personality types. Just because we are different doesn't make one better than the other. Be quiet. We all have an innate desire to be heard. But if you have to wonder if you're being too loud, you most likely are. Not everyone in here has a medical background. Not everyone in here will understand the material. So it's your responsibility to help your friends. You know, I had to have my lovely meme. So let's talk about the history of nursing. In ancient times, mainly medical care was provided by family and male priests. In 1000 AD, women were allowed to study midwifery. And in 1700 to 1800, the poor lower class women provided care in unsanitary conditions. In 1836, the first school of nursing was established by Pastor Theodore Fliedner. Nurses were referred to as Kaiserworth deaconesses, and that's in the era of Florence Nightingale. In 1897, Nurses Associated Alumni of the United States formed to protect against incompetent nurses. Later, this became the NLNE, or the National League for Nursing Education, to set standards and rules in nursing education. You can always Google that. It's a great place to go. You will get so much information, and it's really cool. So in 1892, the first training program established for practical nurses was in New York City. In the early 1900s, licensure was required in some states. By 1955, all states required practical nurses to be licensed. The title LPN is used in all states except California and Texas. They use LVN, or licensed vocational nurse. So in a licensed practical vocational nurse program, this usually lasts between 9 months to 1 year. It is the most basic entry-level program. When the students finish their educational program, they will take the National Council Licensure Examination for Practical Nursing, which also is called NCLEX PN, to become licensed. This examination is standardized in all 50 states, and it's taken by a computer at specified locations. So after passing the exam, the State Board of Nursing that you graduated from will issue you a license after applying for that. Now, an associate degree nurse, that is an RN. That's usually a 2-year program, and it's the entry educational level for registered nursing, which I expect everyone to continue their education. So a diploma, this is a 3-year hospital-based program. I'm not sure if there's any of those around here. But apparently there are some. The baccalaureate degree nurse, which is a BSN, this is usually a 4-year program. And normally this is the degree that you want if you want a management position. So career ladder options. You can literally take your PN, bridge to RN. RN, you can go through and basically, even if you, like when you get your RN or your associate's degree, you can actually bridge to bachelor's or baccalaureate, and you can bridge to master's, and you can bridge to doctorate. So there's so many different ways that you can do that, that career ladder. So we talked a little bit earlier about specialization in nursing. There are so many avenues, guys. There are so many avenues that you can take in nursing. If you like kids, you can go into pediatrics. If you like older people, you can go into geriatrics. If you like acute, you can go into the ER. If you like chronic, you can go to long-term care facilities. I mean, there's a lot of different ways that you can go. But that's the coolness of nursing, is you get to do all that good stuff. So let's talk about the scope of practice. So all nurses are responsible for knowing their own scope of practice. That is the limitations and allowances of what they can do as nurses. In every state, a Nurse Practice Act, or the law governing nurses' actions, exists. This law is written to specifically address each level of nursing. In every state, LPNs are required by law to practice under the supervision of an RN or physician, and RNs are required to practice under the supervision of a physician. Now, the Nurse Practice Act, which each state has one of these, establishes the scope of practice for each level of nurse based on educational preparation. So, such as most places will not let LPNs start IVs, such as acute care hospitals. But in Georgia, LPNs can start IVs because of the Nurse Practice Act. Okay. So the Board of Nursing in each state determines and enforces the contents of the Nurse Practice Act. So if, say, the LPN decides to do something out of their scope of practice, they could literally, their license could be taken away. So just know that you have to stay within your scope of practice, and get online and look at your scope of practice in Georgia, or if you're going to Tennessee, or if you're going to Alabama, wherever you live. Look at the Nurse Practice Act for your state. You're also going to be a lifelong learner. Every single day as a nurse, I learn something different. If you think you know it all, you are scary. And I do not want you to be my nurse. Okay? As a nurse, and to continue having your nursing license, you have to do continuing education classes. You can do seminars, you can do short courses. There's a lot of different free courses out there that you can look up. But you always need to learn how to stay current in your field. Things change daily with nursing. Back when I was in nursing school, the way that they taught us to put in a Foley catheter, the first thing you do is you check the balloon on the Foley. So you hook up the fluid and you push the fluid in to make sure that the balloon doesn't burst. Now, they say you are not supposed to do that because you are putting the patient more at risk for infection. So that's why you have to stay current in your field, because things change. So characteristics of nurses: being responsible. The job of nursing requires that you are able to think critically about each patient while carrying out all physician orders and handling unexpected admissions and emergencies that may arise. While much of your educational program will focus on adults and adult health problems, the elderly population has additional health issues, such as multiple chronic illnesses, sensory deficits, and multiple prescription medications that require you to be even more focused in your assessments and interventions. In this particular textbook, there are these little boxes that are called the Elder Care Connections, and it's all scattered throughout, and they're really actually cool. A lot of test questions come from those, so just FYI. Anyway, so being responsible as a nurse, you're going to be caring for several patients. If you work in the hospital, you'll probably have 6 to 8 patients. If you work in the nursing home, you could have 30 to 40 patients that, as their nurse, you have to see to their comfort and spiritual needs. You have to also treat the families as the patients, and there are many family members that will be with the patients that you guys will be seeing in clinical and after you graduate. So you also have to be very, very responsible in keeping them educated, notified, all those things. And you have to notice change if there's any changes in the patient's conditions. So say you walk into your patient's room and he was fine yesterday, you walk back in there today and he's breathing hard and coughing and all that, then you have to notify the appropriate professional, such as the physician or the nurse practitioner that you are working under. Being honest. Okay, this is huge. This is so huge that I'm just telling you, if you are not an honest person, if you lie, if you cheat, if you steal, all those things, that you're not going to make it in the nursing world. Okay. You have to be more honest than the average person. You can put patients at risk if you make an error. But guess what? If you make an error, you have to be honest and tell on yourself. Okay? Let me tell you what happened to me the other day. I was working, had a patient. There was 2 patients to the room. I walked in. I had eye drops to give to the patient that I thought I was giving the medication to. Come to find out, it was the wrong patient's eye drops. Now, had that been a certain type of eye drop that could cause somebody to become blind or increase their intracranial pressure, stuff like that, like I would have to, if it killed the patient, I would be charged. So I basically wrote an incident report, which we'll talk about later, and told the director of nursing. So you have to absolutely be honest when you're a nurse. When people think of nurses, they think of an honest, caring person, okay? You're always going to put the patient's well-being first, and especially before your pride. It is extremely difficult for most of us to admit that we made a mistake. It's even harder to tell your supervising nurse or doctor about an error. And if you make an error while caring for a patient, it is possible that no one would ever know unless you admit to it. However, for the sake of protecting patients from possible complications, you must be responsible and honest enough to admit your mistake. All right. So much has been written about nurses and caring. Dr. Jean Watson, a nurse educator and theorist, advocates stressing the art of nursing with an emphasis on caring. In this way, nurses respond to patients in a way that confirms their individuality, their emotions, and their needs. A caring nurse does not treat patients in a one-approach-fits-all manner, but rather individualizes care for that particular patient. A caring nurse does not see a patient in terms of a cellular disorder or an illness to be cured. Instead, the caring nurse sees patients as people who have needs for touch and understanding as much as they have needs for IV fluids and antibiotics. In fact, high-touch nursing is just as important as high-tech nursing. So one aspect of being caring, for example, if a patient is an alcoholic and he comes in and you're taking care of him as his advocate and as you care for his whole being, you can make referrals for support groups. You can send him to, AA, and get him hooked up with those type of places. Being organized. Some of us are more organized than others, but you have to keep track of information. You have to make sure that your technical equipment is up to date. If there's any issues, you have to change orders sometimes due to patients' ever-changing needs. You are going to have to make notes, and you're going to have to prioritize care. Now let's talk about prioritizing care. For the rest of this time, while you're in nursing school, and when you are talking about what's most important, you're going to have so many test questions that you have to figure out is the most important. So, say you have 2 patients. One patient is on oxygen and their respirations are 40 per minute, he's coughing, and he's very short of breath. The other patient just got there. His wife is with him, and he's able to walk. He's able to sit in the bed. Which one would you prioritize? You would always prioritize the one who is worse. So if someone is breathing 40 times a minute, you better go see him quick. Okay? We are a profession. We are not a job. Really, we're not a career. We are a profession. So when you talk about being professional, you have to make sure that your appearance and your behavior is good. So would you want a nurse coming in to take care of you if her underarms smell like cat spew and her hair's greasy from not being washed for 3 days? No, of course you wouldn't. So you have to make sure that you are making sure your appearance and your behavior is professional. So let's talk about the opposite, unprofessional. This can include diversion of drugs for personal use. So basically acting like you gave a patient a hydrocodone, but you took it yourself. Failure to adequately care for patients. This is also huge, because if you fail to adequately care for your patients, you are at risk for civil suits and people suing you for neglect or battery, so criminal conduct. Hey, girl. All right. So there's different organizations that promote the professionalism in nursing. Okay. And it's important to be a part of a professional organization, because you can always make changes in the nursing field when you're a part of an organization. You can assist. You can understand things better. You can give your opinions. Now, there are LPN student organizations such as HOSA, which is Health Occupation Students of America, and NALPN, which is the National Association of Licensed Practical Nurses. There are many different theories and trends in nursing practice. So nursing theories are ideas that a particular nurse or nurse educator has developed to explain how he or she looks at the purpose and focus of nursing. One of the most important parts of theory is best practices. Nurses are constantly doing research to test which of our traditional care methods stand the test of evidence. Now nurses use evidence-based practice, or EBP, and you'll hear that forever, as a problem-solving approach to delivering healthcare. This means it uses the best evidence from nursing research studies and patient care data. It also considers the patient's preferences and values. Research is extremely important. Also, there is a thing called QSIN, or Quality and Safety Education for Nurses. This is a project that was established that focuses on the knowledge, skills, and attitudes, also called KSAs, needed by nurses to continually improve the quality and safety of patient care. Now, safety. Let's talk about That's one area of the KSAs that is extremely important in the nursing field. So safety, this area includes ways to prevent risk and harm to patients and healthcare workers. This includes not only the systems that we use, but also the safe performance of each individual. For example, when a nurse reviews a new medication prescribed for a patient and contacts the pharmacy to ask questions about the prescribed dose and route. So she saw the medication, saw the dose, was unsure that that was correct, so she called the pharmacy. And by doing that, she was keeping that patient safe. Okay? We are 24/7 caregivers. We have an opportunity to develop relationships with patients. We can actually influence patients in positive ways as a nurse. And the nurse is usually the one who notices when a patient is worsening. It's going to be patient-centered care. Patient-centered care is a quality focus that emphasizes the patient and their family members as the center of our care and as a full partner in care. Basically meaning that the family is also part of the patient. Which nursing education program is an entry-level educational program for registered students and lasts roughly 2 years? This is actually the diploma program. So the associate degree nurse is an entry level, I'm sorry, actually the answer is B, associate degree. I don't know why it said diploma. The associate degree nurse is an entry-level educational option for registered nurses. Students in these programs attend a private or community college for a minimum of 2 years to obtain their associate degree in nursing. This concludes our chapter 1. I love cats, so you will have to deal with all of my memes. If you have any questions, all you have to do is ask. Send me an email, tdennison@gntc.edu. I am available. It may be until the next day, but I will do my best to answer as many questions as I can. Thank you so much.